Hey, do you ever deal with chronic anxiety or possibly an acute anxiety situation or panic disorder? It has lots of different names, general anxiety disorder. Do you feel constantly stressed out? Well, I want to cover three different practices with you guys that you can do at home or wherever actually to help benefit either a chronic issue, chronically stressed, or an acute situation where you are in a true panic type situation. Now, the first one and my favorite is called the physiological sigh. And if you are familiar with Andrew Huberman, he has a podcast, the Huberman Labs, which I highly recommend. I spend a lot of time listening to this. But one of these practices he's a huge fan of, it's called the physiological sigh. He actually did some research on the physiological sigh and other practices to help with kind of chronic stress during COVID, which we all know lots of people had stress during COVID. So, what is a physiological sigh? A physiological sigh is where you take a deep breath and then you take another sharp, quick breath on top of it to make sure that you completely fill the lungs with air, and then you do an extended exhale through the mouth. So the inhale should be through the nose, both the inhales should be through the nose, and then the exhale out through the mouth. And so I will try to demonstrate, and it should look something like this. And so, if you are in more of a chronic situation where you're chronically stressed, fatigued, and you are just trying to lower your general level of stress, I would recommend doing that for 5 minutes every night before you go to bed. If you are in an acute situation, then you're going to do that until you're feeling more calm. But of the different practices that Huberman researched, that was the most effective. The next thing that I'm going to give you, again, can be used in an acute situation or it can be used in just that to support that chronic level of stress, and that is tapping. Now, this is taken from EFT or emotional freedom technique, and if you are interested in emotional freedom technique, I encourage you to learn more about it. I am using a couple of the points and some of the ideas behind it, but the idea with the tapping is that we are stimulating the cerebellum, which helps to calm the amygdala and helps lower the fight or flight response in the acute situation. Or if it's the more chronic situation, it just helps to lower our general level of anxiety, helps to calm the sympathetic nervous system. So the first point I really like is the sternum, and just take your fingers, find a point on the sternum that feels good to you, that feels solid, that is comforting, and then just take deep breaths in and out, in through the nose, again, out through the mouth while you are tapping. And again, in a non-acute situation, I would just do it for 5 minutes. You can also, the other point is, I believe, small intestine 3. It's right here on the knife edge of the hand, and you can just tap that. And again, there are other points from tapping from EFT that could be used, but I like these because they're fairly inconspicuous. Nobody's going to necessarily notice you doing this. Obviously, you wouldn't be holding your hands up like this while you were doing it, but you could hold it down at your waist level and tap these. Take a deep breath, or you could tap your chest, and it's not going to be super obvious as opposed to if you're going through all of the EFT points. But we have found that to help with patients, help them calm down, either in an acute situation or again in a chronic situation. The next thing is exercise. I would recommend, if you are dealing with chronic stress, absolutely try to get 30 minutes of exercise every day. Zone 2 cardio is kind of the normal recommendation. That's a level of cardiovascular exercise where you can carry out a conversation, but it's difficult. So getting up, getting your heart rate up can help with that chronic stress level. It helps stimulate neurotransmitters to help with anxiety and depression because the exercise helps to balance the neurotransmitters. Also, if you are in a acute anxiety situation, go for a walk. Start walking. It can help to calm things down. You help get out some of that nervous energy. And so if you're able, get out and get a walk. 30 minutes every day, again, can benefit the fight or flight response and just a general level of anxiety or stress. So those are my 3 practices. I hope you find these beneficial and look for my next video. Thanks.